Hello everyone, this is Dr. Jawad. Thanks for watching my channel. If you haven't done so already, please hit the subscribe button down below and right next to it, hit the bell notification. I try to upload videos weekly, and when I do, you'll be the first to be notified. Also, feel free to look at my webpage at www.totalhealthdebate.com, and in the upper right hand corner in the functional medicine tab, if you click it, you can actually schedule a free 15-minute consultation with me, one-on-one. My times are limited, so make sure you check the schedule. Otherwise, hope you enjoyed the video and have a good day. Hello everyone, this is Dr. Jawad. In this short video, I'm going to answer a question I get emailed a lot, and it's in regards of pain and organ systems. How do we delineate which organ system am I looking at in according to the pain? Now, here's the thing. Now, how do we get this? These are all called hormone disruptors. We get it from heavy metals, omega-6s. Now, remember, omega-6s cause inflammation. Omega-3s are the anti-inflammatory. Excess carbohydrates, gluten. Are they taking in too much gluten? Okay, are they around too much mold? There's a lot of houses that were just built in the early 1900s that constitutes for a lot of mold. So yes, that's going to be a huge endocrine disruptor. Pesticides, leaky gut. Do they have a leaky gut, which is causing systemic inflammation? Now, collectively, these are all inflammation-induced hormone disruptors. Okay, it disrupts the hormonal system. Now, the question is, which system are they being disrupted? Well, it could be according to signs and symptoms. It could be according to patient history, and so forth and so on. Now, this is just a baseline of how I look at things. One, it could be your thyroid. Abnormal weight gain, muscle pain, and fatigue. Because remember, the thyroid gland has a huge impact on how the body works. And if you're having a thyroid dysfunction, sure, you're going to have the weight gain because you're going to have a sluggish metabolism. You're going to feel fatigue because one of the functions of the thyroid is to provide energy to the system. Next is your adrenal glands. Now, one thing that is certain that the adrenal glands work synergistically with the thyroid, because with adrenal glands, if you're dishing out too much cortisol slows down the thyroid. So also it's increased inflammation. Are you just in this chronic pain cycle? Do you have blood sugar problems? Because one of the functions of the thyroid gland is to stabilize blood sugar with the use of cortisol. Weight gain. Okay, so then now, again, too many carbohydrates, insulin. Now we're looking at the pancreas. One of the functions of insulin is dynamic because it has two functions. One, to lower blood sugar and also store fat. So when you're having all these inflammation-induced hormone disruptors, you're looking at the pancreas, the effect the insulin has on the body. Because again, now you're looking at unstabilized blood sugar. Are you becoming more insulin resistant due to the fact, what are you eating? Or also too, what are you around? Now with the ladies, you're looking at the balance of the estrogen and progesterone. There should be a certain ratio. Now, is she having menstrual pain, breast tenderness, infertility issues, which means constitutes for more estrogen dominance? How is she getting it? Is she eating it through too much sugar, through bread, through gluten, through GMO? Is she drinking it with the bottled water? Is she taking birth control? Okay, because then that's going to throw off the estrogen balance, which will cause you to have breast tenderness, infertility issues, and definitely menstrual pain. Now with the guys, what I'm looking for the levels of testosterone. Now, a full testosterone panel, blood panel, will tell me exactly where he's at. However, with the patient history, again, you're looking at muscle weakness, pain, weight gain. The number one thing, loss of libido. Now, with a young male, he shouldn't have a libido of an 80-year-old. Now, the problem is with the foods nowadays, again, with the testosterone and estrogen, it should be 80-20. You should have 80% testosterone, 20% estrogen. But the problem is, if you're eating the GMO foods, if you're eating sugar, if you're eating too much gluten, if you're drinking too much beer, what's going to happen is it's going to stimulate the estrogen receptors, which is going to increase the estrogen and lower their testosterone. Males, you should not have a low testosterone at the age of 30 now, okay? And that will, again, constitute for muscle ache and pain because you need the testosterone for muscle building. The loss of libido, your get up and go is gone. Okay, so again, this is the baseline of how I'm thinking when I treat patients. Now again, if you want to give me a call, 630-653-2225, or best bet, go on my website, www.totalhealthdebate.com. In the upper right hand corner, you hit the functional medicine button where you can schedule a 15-minute free consultation with me. My time is limited and there's a calendar on there. So hope you enjoyed the video. I'll see you in the next one. Take care. Hello everyone, this is Dr. Jawad. Hey, over the last couple of years, my YouTube channel has grown tremendously, and I can only appreciate it, the viewers who subscribe. Now, if you're watching this on YouTube, please hit the subscribe button to get the first up-to-date videos, or you could always Google my name, Dr. Janan Jawad, and you could go to my JDoc Real Minute page. Again, if you hit the subscribe button, you'll get the most up-to-date videos, and thanks everybody who's watching. I greatly appreciate it. Thank you.